So, good afternoon, everyone. Welcome to our monthly HealthTech talks. Now, as you must be knowing that after the COVID pandemic hit us, we had a technological acceleration, and one of the places where the tech acceleration took place was in the healthcare industry. HealthTech has taken off in a big way, and that has been one of our focus areas. We have been coming out with many special editions for PCQuest print magazine. We are doing an annual HealthTech event, and also we are doing these monthly panel discussions to bring to light to the public what all things are happening in HealthTech and all the progress that has been made. And also at the same time, PCQuest was launched in 35 years ago in 1987. So we are also celebrating our 35 years of PCQuest. So you can head to the website and know all about that. But I think it's time. Let's move on to the panel discussion and the topic of the day. So today's topic is infusion of tech transforming diagnostics. So here's the thing: we talk of the healthcare system, we talk of hospitals, we talk of the pharma companies, we talk of the vaccines. But whenever anyone falls ill, probably the biggest thing is diagnostics. Unless you're diagnosed properly, you can't move ahead. So and the way technology has been affecting every area, diagnostics is no different. So, to discuss that, I'd like to call Rohan Aggarwal, founder and CEO of Vidcare. Welcome, Rohan.
Thank you, Sunil. Thanks a lot for having me here.
Sure. So, I mean, before we go on to the discussion, maybe you can just give a brief, intro about what Vidcare is for many of our viewers who haven't heard of the company.
Sure. Thanks. Hello everyone. My name is Rohan Aggarwal, founder of Vidcare. So, Vidcare is a at-home diagnostics company developing the world's first easy-to-use, equipment-free quantitative blood testing device. So, as you know, that right now current lab diagnostic tests are sort of inconvenient, inefficient, and mostly a dreadful experience for the patient. So, if you want to do any diagnostic test, you need to go to a lab, have someone poke a needle into your arm, collect a large vial of blood, and then you have to wait for at least 2 to 3 days before it can actually get the results, and you can go to a doctor and get your diagnosis properly. So we want to change that. We are building one of the world's first easy-to-use equipment-free diagnostics technology platform. So what it means is that you can do the test just using a simple device. There's no electronics or separate reader that is required, which is very different from any other company in the world. So all you need to do is add a drop of sample, wait 20 minutes, and you read results just by clicking the picture of the device with your smartphone. So it can be used by patients directly at home, and you can consult a doctor online to close the whole cycle within 1 hour compared to 2 to 3 days it takes currently. So our flagship test that we are coming out early next year is a test for hypothyroidism, which measures thyroid stimulating hormone or TSH. And so that's pretty much about what we do. We are based out of Pune, so if you are around in Pashan area, please drop in anytime.
Yeah. So sounds exciting. Before we come to those specific things, I'd just like to, discuss some of the broad areas that have happened in the last couple of years. So first, let's discuss the healthcare system. What are the major changes that have taken place in the healthcare system as a result of the COVID crisis? And obviously, diagnostics is a part of that. So maybe if you can first speak of the general healthcare changes, then specifically about diagnostics.
Yes. So over the last couple of years, I think one of the most important factors. So prior to pandemic, the biggest issue that people faced, or I wouldn't say people faced, but the status quo that people did not really used to care about health. So health was something that you take care of when you get sick. So prevention not basically an option. So after pandemic have started, there's an increase in awareness around general health and hygiene. So there's an increase in number of in the sale of vitamins and other supplements. There's a increase in various kinds of health testing devices, and also there's an increase in number of people who are doing various kinds of exercises at home. There are numerous reports and articles that you can see in the media. Another important factor is that there's an increased access to healthcare, not just in urban area, but there's also an emergence and acceptance of telemedicine all across the industry. So telemedicine, uh, like we are right now interacting online. Similarly, you can now it's very common for patients to interact with their doctors through video call than going to a visit, than actually going to the hospital to the OPD and get a personal visit done. This made a number of actually this has increased accessibility in the sense that earlier the top doctors could be only accessible to a certain class of people who are living in, say, Delhi, Bombay, or Delhi, Mumbai, Bangalore, or larger cities. But now even people who are staying in smaller cities can get access to the best doctors without being able to go to those cities in person. Other areas that have emerged are things like home diagnostics, which has actually emerged much faster than it was earlier expected. So you can say this, especially at home healthcare or home diagnostics, has kind of taken a 10-year leap in a period of 1 to 2 years. Right? These are the broad areas around which most change have taken place.
Okay. So I'll come back to your, like, diagnose at home and all that sounds pretty good, but maybe something about the diagnostic devices that are used in hospitals and elsewhere. So you're in this field. Are diagnostic devices becoming faster and more portable and convenient? And what changes can we expect in the next few years?
Yes, so as we go ahead, obviously they are becoming more accurate, faster, more portable, and convenient. So um, as especially the convenience and fast and portability aspect increases the rate at which products are adopted, not just in hospitals but also across domains. So, for example, I think something that we all know is a glucometer. Earlier on, when uh, testing was started for glucose, it was mostly restricted to labs. Then slowly and slowly, companies like big AccuChecks and all these kinds of big brands came in. Now, a number of smaller companies have also come up with their glucometers. And now, you don't even think about checking your glucose as a diabetic patient. Uh, think about going to a lab to check your glucose level. It's the most intuitive thing is that you test it at your home. Similar is the case with pregnancy and now with COVID testing as well. So before you actually look for RT-PCR, you actually buy uh, some or the other COVID testing kit and do it at home. So right now, I think that's kind of what where we are going in other areas as well. So right now, mostly you have fitness bands, you have IoT devices, but we are also going to see a lot of clinical chemistry and pathology tests coming up in this space as well, and which you can easily use at home or in field settings where they may make more sense, or even in doctor's clinics. So you can say that as you go ahead, one when you're visiting a doctor, for example, you will the doctor will be able to test for the condition that you are like for those particular condition at your within the same visit, get you the results right then and there in about half an hour or so, and you can then go towards and then you can get your diagnosis and treatment can start immediately. Currently, you have to you go to a doctor, you then the doctor writes you a few tests, you go to a lab, the lab will take a sample, it'll give you back your results in about a day or two, couple of days on an average, and then you go to a doctor and then he writes your prescription and so on and so forth. So this kinds of making more easy portable testing can make the whole process much faster in less than an hour. Even at your doctor's site, you can get your prescription done. And the
Okay.
same can actually happen in telemedicine by being at health centers. You can interact with a doctor, a nurse, or a helper person in that particular telemedicine clinic can actually do the same thing with you as well.
Okay. So actually, I'd like to expand on that. That sounds interesting because now you're doing diagnostics at home. Patients can test themselves at home and monitor their health through, wristbands and IoT devices that you mentioned. So, and also you have talked of telemedicine and, diagnostics at home taking a 10-year leap. So maybe I'd like if you can expand on this. Like, so, like the first stage is you diagnose at home. So what is the status of the diagnostic devices? How accurate are all these, like glucose check and all that you have talked about? And maybe you can even talk about your smartphone and thyroidism app. Then second stage is telemedicine, because once you have diagnosed yourself, you'll like to avail telemedicine. Then I'd like to know how this new ecosystem is panning out, because in the olden days everything was done in the hospitals. Now probably you can say there are three stages. You diagnose at home. If you're well, fine. If there's a problem, then second stage is telemedicine. If he can sort out your problem, is fine. If not, then only you'll use it. So maybe if you can give people a flavor of this, it's a brand new ecosystem which not everyone has come to terms with yet.
Yes. So Sunil, the first step is actually understanding what test to done. So usually you'll go to a doctor or consult them online. The doctor will tell you what test to run, or if you are already suffering from a condition, you probably know that you have to run a glucose sensor or a TSH test every 2 to 3 months. Uh, so you get the test at home. You prick your finger in the morning. You put the test in the device. Like for what we are making, it's small credit card size test. You put a drop in that, and after 20 minutes, you get a reading in form of a line, and the length of the line actually with a you click a picture, and the length of the line can translate into a digital result. So once you do that, you then share that result with your doctor, and your doctor will actually tell you what the next steps are. Eventually, so this whole process, again, the speed of this process increases a lot. So telemedicine is a very good enabler for this. It reduces the time significantly. So I'm again saying time because time is the most essence. Also, including telemedicine, it reduces the uh, this cost in travel as well as time. There's a lot of cost effects as well that are improved once you're able to do testing at home and consult the doctors online. So for various conditions like various low risk or moderate risk conditions, testing at home is a very viable option. However, for high risk conditions and certain scans, you still have to go to a specialized path lab or a hospital to get tested. So, for example, for X-rays and MRIs, still going to take some time before we actually have facilities in around our neighborhoods.
Okay. So I'd also be interested in your personal experience with hypothyroidism. So maybe you can walk us through that. What is the condition now of the way people diagnose themselves, and many don't diagnose and they suffer, and what you are offering to the market? How do you think this will be a game changer in this particular field?
So I'll give you one example, probably more towards how important it is. Not so much from an urban perspective only, but let's say we look at a patient in say a rural area or a semi-urban area. So for them, if they want to get a test done right now, the only option that they have is to go to the nearest town, often a medical college or a district or sub-district hospital, where they give a sample, and then after 3 to 4 days, the results come, and then they again have to visit a doctor and get their treatment started, and so on and so forth. So when they go to when they go to the nearest facility and get the test done, it takes about a day for the whole to and fro travel. Then again to go to doctor. So it might so from their perspective, they are wasting 2 to 3 days just to get a single test result. So as a result, what happens is, as an outcome, they often avoid the test because for them, going to a sub-district hospital for even takes about 5 to 6 hours on an average, uh, and they're not able to make that livelihood for that particular day. So the other option is not getting tested and suffering the consequences as they come. So for most people, putting food on the table comes first than actually preventing onset of conditions.
So,
So
yeah, sorry, continue.
So making at-home test or making point-of-care test, which is a more generalized term for these kinds of things, what it helps is it helps put the test in the most decentralized levels of public healthcare system, where the patients can get the test results done within their vicinity or of their home vicinity, within the villages or their nearby areas. As a result, they can get the test results very quickly, and the treatment start quickly as well. So they are not going to waste the time that they were going to waste otherwise, and you basically preventing various conditions. So for thyroid, for example, pregnancy is a very big use case. So about 44.3% pregnant women suffer from hypothyroidism in India. A lot of them go undiagnosed. And just by doing a simple TSH test, about 50 to 60% of adverse outcomes can be reduced. This is a lot. So adverse outcomes includes miscarriages, eating disease, and various kinds of premature birth. Various kinds of developmental disorders can be prevented. And I think on an average, about 7 IQ points का difference आता है in offsprings uh, if you get the proper thyroid level.
Okay.
If the couple has a proper thyroid level, so the offspring has an average. So compared to a hypothyroid mother, a euthyroid or normal thyroid mother, so the difference in the offspring on an average would be around 7 IQ points, which is a very big difference in today's perspective because it can affect the way they live their life by quite a large margin, and has a relevant economic impact on the society as well. So simple 200, 300 degree test can make an outcome of like significantly larger outcome.
So your testing, you started the home testing kits with COVID-19 first.
No, we haven't started with COVID-19 yet. We
Okay, so
have not
what?
actually been going towards COVID-19 now.
Okay, so is home testing of COVID now not that? Is it on the wane, or what is the latest situation? I guess. Are we out
No,
of the pandemic? And so,
looks like looks like we have enough test on the market now.
okay,
So
okay.
any new strain that is likely to come will probably require a new kit. So
Okay,
it
so
doesn't.
how easy will it be able to develop a new kit? Because I think we have really scrambled in the last 2 years. So this experience can be
Yes. So once you have a system in place, kits can be
right,
developed very rapidly.
right.
Once you know what you're making the kit for in immunodiagnostics, which is a field, you can actually make a kit fairly quickly in a few months.
Okay.
Uh, as we have seen from COVID, some companies have been able to do it who had like a lot of resources in a few weeks as well.
Hmm.
So yeah, I think that's fairly possible. If a new strain comes in, there are companies who are actively working on these COVID only, who can get the kits out very quickly. I think for that is something called pandemic surveillance, so outbreak
Okay.
surveillance and all. So there are agencies which basically uh, keep preparing for, like, they track what is going on across the world in terms of strains and how those strains are different, and then they share that data with researchers as well as some companies who have some interest in that, and accordingly they keep on iterating and coming up with new tests which can be helpful for diagnosing new strains. So probably I ventured a little out of what you asked.
No, no, it's okay. It's just this is just a
But
informal discussion, just to get a
yeah,
general idea.
but I can't say like if you're out of COVID,
Okay,
if you're pandemic or not, because I think every time we feel that we are out,
right.
a new thing comes in and the Diagnostics wreaks havoc. So yeah, I mean we don't know if we are out or not, but definitely right now it's much better than it has been in the last 2 years,
Okay.
and hopefully it stays this way.
Yeah. So, and also like before moving forward, what are the kind of testing that can be done at home? So I assume like blood pressure, glucose. Right now, what is it possible for to do everything, or it will always be just say 5, 10 conditions? So maybe if you can talk about that.
So right now, the most common parameters that you currently check are your heart rate, your pedometers, and general health parameters. Apart from that, your glucose testing and pregnancy testing. And COVID is one, and a few other infectious diseases are also there. Fertility testing is one, but most of these tests are like yes or no test. So they can
Okay.
tell you if you have a condition or not, or if you like in case of fertility, is there a high chance of a couple conceiving at a particular time or not. Apart from that, there aren't too many tests.
Okay.
Uh, so what the currently the need is for more accurate and more quantitative tests. So when I made quantitative, it may basically test that give you measurable levels. So because any clinical decision is going to depend on your levels. It's not going to depend on if you have a deficiency of something or not. So even if you get a yes or no result for let's say a TSH or a vitamin D or a HbA1c, which are the most some of the most commonly done tests, uh, the doctor will not be able to give you any medicine like what dose to give. He will not know. He or she will not know. So they will anyways ask you to get a test done for quantitative. So the next step for companies like us, what we are trying to do is we are trying to provide tests which can be done at your home and give you precise levels compared to just a yes or no result. So when you get a precise level, the doctor can actually tell you how much dosage of the medicine is required to be taken at what frequency. So this is more actionable data.
Okay. So then, what about variables? Will variables help? And is it possible for maybe people in rural and semi-urban areas to have affordable variables? Where are we on that front?
Um, So variables right now are, I think, at one of the most affordable price points for many of the conditions, for many of the things. So the most common, I think, are the fitness bands right now. So you can get a fitness band for as low as 500, 600 rupees as well.
Okay.
Obviously, the quality is
Yeah,
different.
sure.
Well, but there are fairly decent fitness bands available which can give you reasonably accurately uh, analysis of how many steps you have done, and based on that, some calories and a few other parameters, similar parameters. Uh, Sorry, I missed the second part of the question.
Sorry, I didn't hear.
I missed the second part of the question.
Yeah, so no, that's what I was saying. It is more about affordability. So that you answered at the beginning, and also I think going forward it might become compulsory for insurance companies because insurance companies are looking forward to everyone wearing their wearables all the time.
Yes, I think once they have the data, they can tell you how much premium you have to pay.
Right, right. It'll be more customized, health insurance premium for.
Yeah.
So, yeah. So one thing I was saying, like I'd read a bit about you. One of the things that you talk of is accessibility. One of the most important things is accessibility. So one thing is like in 2018, 2019, and now you look, I think accessibility has really gone up thanks to whatever you have talked till now. So maybe if you can speak about the problem of accessibility and how maybe some of it has been already sorted out in the last few years.
Uh, Accessibility is possibly one area that as we as a country are struggling a lot with. So there are four issues that a country suffers when it talks about public health. First is your awareness, then comes your accessibility, availability, and affordability. So affordability and availability will not talk about. One first thing is awareness. So I think on the awareness front, we have done better than we had done before, but still there's a lot to do, especially in public health systems and especially in remote areas where access to good media is not there, where people don't have enough good smartphones or do not have reliable internet connection or does not have uh, good information in local languages which they can understand. So I think there guys like
Right.
you can do make the largest impact.
Yeah.
Coming to accessibility, prior to 2010, India, as per certain rankings, India ranked about 150 among 170 or 180 countries.
That's
When it
terrible.
comes to accessibility. That's terrible. I don't remember the exact ranking, but those are
Yeah,
around this.
I know, but I know roughly it must be there only. Yeah.
So right now, I guess it would not have been much better, to be honest. I don't think we would have moved up more than 10 or 15 points
Okay.
above that. We still have a long way to go. The problem comes in terms of a disconnect between the lowest strata and the tertiary level care, and there is not enough resources that are deployed in the decentralized subcenters and primary health centers. There are various reasons for that. There sometimes it's also an issue of technology gaps, not so much to do with logistics at times. Sometimes it has to do with logistics in certain cases as well. So I wouldn't say that it's essentially a system failure in times, but there's also uh, an issue of filling the gaps, which sometimes even the bureaucrats cannot do very like can't do because there are no resources, viable resources to do that. So that is also where companies like us or other people who are working in this space can play a major role. So innovative products can uh, make a big change. For example, I think a few years back, uh, if you had a delivery done of a child, uh, the only thing, if they needed an incubator, there was only one kind of incubator available, which used to cost a few lakhs. Now there are devices and incubators which are very, very cheap, a few thousand rupees, and you can get a decent incubator which can at least keep the child healthy for a certain period of time until they can move to a better facility. I think technocrats like us can make a lot of difference. In improving accessibility. Obviously, government has to be in a major role. Various stakeholders have to be willing to take part and make this a priority as well at the same time, so that all of us can work together and uh, make the whole system more accessible to the common
So
citizen.
yeah, so I'd like to maybe shift a bit to the technology behind all this. So one of them is artificial intelligence and machine learning. So health tech, there is a lot of AI in health tech and also big data, data analytics. Because before, I mean, data was offline, it was not accessible. But now a lot of data is coming online. It is being digitized, and things like wearables is giving a huge amount of data. So in the health tech, what is the role of AI and big data in that? If you could speak about that.
Yes, like it's amazing. Like data enables us to do things that were previously not possible. Um, like there's a long list of things that you can do. So let me just so from a research perspective, you can use the data to correlate between different parameters for research purposes, which was not earlier possible. Make predictions for people and how they can take precautions. You can use GPS data enabled with your along with your test results to manage outbreaks and various and to better prepare for pandemic or future pandemics or outbreaks. So basically, uh, broadly, I'd say like areas like risk and disease management, for learning and development, um, for hospital management, for various health center managements, uh, from from financial points, reducing frauds. Uh, Telemedicine is obviously an important issue. Real time, may what is happening with the patient, you can get that, so which can help the doctor make better decisions. Uh, so basically, better patient predictions. So how, based on the parameters of the patient, how are they likely to develop a certain condition over a period of time? Uh, then obviously medical imaging is another very common, very important area. So as you get more data, you're able to increase the uh, accuracy of uh, so when you're analyzing X-rays or MRIs or anything like that, with more data, you're able to do this much better because the doctor who's evaluating your scans can actually make more informed decisions because they have more data to back on, and the data with an analytics incorporated into it can give you better can also suggest you what other things are possible with that. And apart from that, obviously, developing new therapies is important, and uh, you can also augment with um, augmented reality based applications are there. Robotic surgeries can be enabled. So a lot of these have their root in digital health and healthcare data, and a number of applications that can be built upon that. Electronic health record is possibly one of the most important data set that you would require for a lot of these things. So I can go on and on about the number of applications that you can do with AI and ML. It's enormous.
Yeah, so like one thing you mentioned was augmented reality. So what is that? Health tech in the metaverse. I mean, right now metaverse is a buzz term. So could you ever like visit a hospital in the metaverse? Is that possible, or is it too far fetched?
I can't say.
Okay,
Possibly, I think for some conditions you might be able to do that. Uh, I think one place where it may actually make the most sense is mental health, something that we didn't
okay,
talk about much. So
okay,
I think mental health is one place where it can make a lot of difference because I know a number of companies in India and globally who are developing various applications for treating several mental health conditions with the applications as well as augmented reality games and stuff like that. And some of them have been actually approved by FDA as well,
okay,
or are in the process of FDA approval in the US.
okay. And another thing you sorry, continue. Sorry.
Oh no, I was just saying that it's quite an interesting area again.
Okay. And another thing you mentioned in that answer was medical imaging. So, like abroad, we have said that the more MRIs, the more X-rays that artificial intelligence system scans, the more accurate it becomes. But there are also genetic differences. So we cannot rely too much on the data. So what is the status of medical imaging and digitization? So it's like I read for everything, whether it's fractures, liver lesions, for everything. If you have enough data, then the AI can predict, and that helps the doctor. So is that one thing that is happening in India?
Yes, so there's a company based out of this guy from IT Bombay, who I forgot the name of the company. It's quite an innovative product. I think they were the first in the world to do that.
Okay,
So they were able to pick up a 2D X-ray and make it 3D, which actually gave a lot more information to the doctor. And I think they use a lot of AI ML again to build that kind of a thing. And now I think based on that, a few other companies from other countries have come up with similar thing. But I think that's something that somebody in our country pioneered. So
yeah.
we be proud of that. I think it's a very big uh, technical feat as well.
Okay. And another thing you mentioned was the electronic health record. So EHR, EMR, what progress have we made? Are we going forward in standardizing it and digitizing everything? How much progress have we made on that?
So there's a India health stack or Bharat health stack that is coming up in that space. The progress on that I think is not very
Okay.
uh, quick than what we had wanted from what I know of. But right now, I think the major problem is that before that, I think the major problem was that we didn't have a structure and everyone was working on a different frequencies. But now I think some people have a basis on what base level on what they need to have in an EHL for India. Uh, so I think we are on the right track. We probably can make faster progress.
Okay, so I'll just I was about to ask a question on this topic. It's like you mentioned, like bureaucrats don't have enough resources. Then that is where technocrats can step in. Then we do have India Stack, which is the largest open AI system in the world. Though you are saying Health Stack, not much has happened, and there is also Ayushman Bharat. So I was just wondering, there's that much which the doctors and startups can do. I think the government has a big role in all of this. So what is the role of the government in all of the above? What are the policy changes they have to make to help, and what more can they do? I mean, so I would like to know, what are the policy changes, extending this India Stack, standardizing EHR. I mean, there's a lot of things the governments can do. So if one by one, if you can take them up, I'd be interested to.
Yes. So I think the most important thing that when you talk about health stack or for digital health in general, um there has been a lot of applications definitely, but we still there is not a, like from what I might be slightly wrong on this. That's not exactly my area of expertise, but based on what I am aware of, there is not. Uh, There are a lot of different companies or different organizations working in uh, isolation, and there is not a very robust system to put all patient data into a single place, and and other people will be able to access that easily. There are principles around it, but I'm not sure entirely how well they have been executed. The principles are solid. Probably they can be, obviously everything can be improved further, but obviously there is a right start that has happened on that front. But I believe that progress can be made faster the way we did with a lot of other things, especially in fintech. I think that maybe we can have a little more progress, faster progress in health. So, and coming to the bureaucrats and how technocrats like us and other business people can work together, I think it's most important that we all work together. Some of the areas that actually I think so I'll probably is that there so government needs to probably introduce policies which are more progressive and protect industry and innovation and safeguard patient interest. What I mean by that is that we have to create policies which protect the local industry because you need organizations making progress for India in India. So as you have seen with COVID, for example, the most significance, the most impact was created by local organizations. Like you have a number of other companies. Um, and probably you already know a lot of names of my lab and Serum and uh, like Tulip and all these companies, which were all Indian companies, Morbio and all these companies, which made a lot of devices, and these devices were again, or vaccines were again used not just in India but all across the world as well. So, and in the initial part, I don't think there was any company from outside India which took a lot of interest in solving problems for India during the pandemic, and it was these local companies who actually came up and solved it. So I think we as a nation needs to protect our industry and innovation ecosystem so that uh, medtech and digital health companies can come up with innovations which are more India-centric, solve problems for the developing world. Because another reason I think for getting India-centric or developing world focused uh, products is that most of the imported products they are made with keeping the European or the American patient in mind. So the requirements are very different, the socioeconomic conditions are very different, the patients are very different. Um, so we need solutions which solves the problem that we have here. So an incubator which costs like a few lakhs cannot be used in a primary health center in India. You need a small heated jacket to keep a baby healthy because you cannot afford to keep a 10 lakh, 5 lakh incubator in a PHC. And same with diagnostics, you can't have a 10 lakh, 5 lakh and an auto analyzer in a primary health center because it does not make economic sense. Right? And we are not the richest country in the world to be able to do that.
So
Yeah, sorry.
no, no, it's okay. You can continue.
Yeah, so I think that's pretty much the most important thing. So, apart even from a digital health perspective, I think we have made a lot of progress. Uh, I think that also has to be uh, focused more on the fact that we have a very thriving IT ecosystem in India. The barrier to entry is fairly low. So digital health is still more possible in India, but you at the same time need to have a lot more focus and um, uh, more the bureaucrats need to make sure that there's more innovation in the hardware space also happening in India with medtech companies and pharma companies as well as drug discovery and so on and so forth. Because I think that's something that is not that still requires a lot of work for India because you require a lot of capital to be put in those places. But the outcomes basically are much more valuable, but not just in terms of the people it can reach, but also in terms of price points and how it can impact our economy in a positive way in the long term.
So I guess make in India hardware is also very important. We just talk of apps and all in this particular field because you can't do
Yes,
without.
hardware is the most important thing. Like you see in China, like they're using Chinese phones. They're using Chinese phones and American phones and European phones.
Right,
We don't think we have a major brand left in India, which is India brand. I think Micromax was the last one, and I
right,
don't know where Micromax is right now.
true.
So I think we need a lot of support in India for hardware, and not just in like probably health and medtech, but in all domains. But I think health it's very important because it relates directly to the life of a person. So, and in adverse conditions like the pandemic, we've seen how important that is.
So also like coming back, what are the changes that have taken place in the health tech startups, the med tech, digital imaging in the last 3 4 years? I mean, would you say that there was an acceleration, but are we on the right track or are things falling flat now? Have we learned from the growth? It's like just because all of you health tech startup founders must be sitting and discussing what is the actual scene as of now in 2022.
So there are various stages of startups. So startups which were slightly at a more advanced stage, they did a lot of progress over the last 2 3 years because after the pandemic, there's been renewed interest in health, even from investors. So for developing tech, even hardware, you need a lot more capital um, than probably an app does, and there's also slightly more risk uh, for such a thing. So companies who are at a slightly later stage were more lucky in that sense during the pandemic. Companies which are slightly at the earlier stage, a lot of those companies have shut shop because there weren't too much interest or there weren't too many investments happening, which was contrary, very interestingly, from a lot of other ecosystems globally. So I'd say that we need a lot more money. Even in general, people who uh, should also look at making more like investors. I'm talking about, say, angel investors, for example, which are uh, often not people who are like super rich, but reasonably rich. So I think even at a small level, those kinds of people can make a lot of difference. And supporting with, even if you put a few lakhs, like 10, 20 lakhs in a company, for a health tech founder at an early stage, it makes a lot of difference because they're able to get ahead. Obviously, the risk is larger, but the impact that it creates is enormous, and in long term, it gives you a lot of things to build upon. So I think one thing that has happened good is Shark Tank from that perspective. It's
Yeah,
given access
correct.
to a lot of has given people a lot of other areas to think about as well, apart just not the apps.
So, do you see a lot of health tech unicorns maybe in the next 10 years, or will we
Absolutely.
have to wait? Okay.
I hope we are one of them.
Okay, great. Yeah, best of luck. I'm sure that would be great.
So definitely, I think, yeah, I suppose we can have a number of health tech startups as unicorns in the next few years. And I would really like if many of those startups are device startups or drug startups, for example. I know some really good therapeutics and people who are doing globally innovative work, not just here we are first in India or something like that, something which is
Right.
groundbreaking in their respective field. So I hope many of these companies, some of those companies are run by some of our friends. So I think I would really love if some of those companies actually become unicorns.
Yeah, let's hope that happens. Accessibility and universal healthcare, those issues will be sorted out.
Yeah.
So just one slightly like controversial thing, and usually like it's supposed to have great benefits is what about genetic profiling to handle diseases and help prevent them? Will this work on both old and upcoming diseases? And a lot of people talk of benefits of genetic profiling and predicting and giving a drug cocktail accordingly. But then there are dangers of this. So maybe if you could speak about this issue.
Yes. So genetic profiling is a controversial area, as you said. It has some ethical issues. We'll not go into those things, but so basically, at the base level, it helps us understand from a disease perspective. Obviously, there are a lot of other applications in forensic and paternity testing and whatnot. But from a very base level, from healthcare and disease perspective, the most common application right now for people is uh, the most consumer centric application is about fitness, around fitness and all, because that's has the least risk associated. So what foods supports you and all that. I think everyone knows about that. Like there are a lot of companies which give you a genetic profile and
Right,
tells you what foods to eat, what not to eat to lose weight or gain weight or what not.
right, right,
Apart from that, I think the most important is towards from a fetal perspective. So once there is a child, when a mother is pregnant, a genetic test can help understand if the fetus is at a risk of developing genetic disorders and like Down syndromes and others. So and it can actually um, sorry, and it can actually help save the patient and help them live a better life if they're able to do that. But obviously, there are issues where people use that for, say, coming up with other. Just one second. So, uh, yeah, and obviously there are issues where there are scenarios where people are able to work on stuff which is probably not very ethical. So even one from fetus, there is a concept of designer babies.
right,
So basically, by profiling the baby and then gene editing, you can change the genetic structure of the child to suit features which are more attuned to your liking. So having a very fancy nose, like say some famous actress, or a chin like say some famous jawline of a famous actor or something. So those kinds of things are important, are possible, not important, are possible, but it has a big ethical issues, because obviously the rich can afford it, but the poor cannot, and it again these kinds of things will increase the rich poor gap enormously, because you are able to control, you are able to overcome the natural process and remove all the limit, all the natural restrictions of a human that were otherwise there to reduce that gap.
No, but I was thinking, I mean, if you look at this in positive light, they say prevention is better than cure. So if you can know before the baby is born what, not from the designer baby, from the point of view of what the health problems could come, then throughout the life, if you're always wearing an IoT device, if you're doing testing at home, if you're having telemedicine, then I think this will not only keep you abreast on your health, but it will also unburden the healthcare system. So, do you see this all this actually becoming a reality, and also in India and rural areas? More important.
Yes, I think that this will definitely become a reality from a disease perspective. I don't think from a designer baby perspective it will become a reality because of the various ethical issues.
Sure,
But from a disease perspective, it needs to become a possibility because there are a lot of children suffering from various genetic disorders, which they should not be suffering from. So it's just natural process, margins ka khel hai kind of thing, where a patient suffers from a genetic disorder. So they should not be doing that. And I think gene editing technologies like CRISPR and all those things can make a lot of impact in those areas. And we would be, yeah, I think that's possibly one of the important steps going ahead in the next 10, 20 years, how these technologies change and how affordable they become also. Uh, so the way in last 20 years gene sequences have become very cheap, we hope that this the profile, the editing part is also equally cheap, because it also doesn't make sense if you are able to diagnose a condition and not able to treat it.
not able
So
to.
it also has to become easily very cheap. As far as accessibility of these conditions in a country like India, I believe it will take a longer time, probably not 10 years, maybe longer than that, just because of the complexity of society and the system.
Yeah, but I would say we are getting there in India, I think. And also another thing, if you add AI to the mix, it's possible for everyone to get personalized healthcare and a personalized insurance. And I mean, that they talk of personalized, is that possible going ahead in the future?
Yes, definitely. I think as we go ahead with more data, we'll be able to predict a lot of conditions, how much premium you need to pay. So you can either pay less or you can pay more. What supply chains can be managed more in properly by pharma companies, so the medicines are more available in the places that people actually need them, and at the same time more personalized. Uh, so, for example, a patient with a history of diabetes can probably, with a family history of diabetes, can make better choices based on their current levels. So, for example, let's say if you have a lot of data down with your various trackers and devices and hormone levels and whatnot, from a research perspective, you'll will be able to also do stuff which was not earlier possible. So, for example, what conditions can be early markers for onset of diabetes or onset of certain kinds of cancers? So you can actually, hopefully, we will be able to see that as well as we go ahead. And this will be only possible when we have more data from each patient, a number of larger patients, which are otherwise not possible in a research setting.
So I'll before we go, I'll ask one last question. What is the one big idea that will change Indian diagnostics in the 2020s?
Realistically, I
One big
think
idea, and you can expand on it. Yeah.
so. I think couple of big ideas are there. Obviously, digital health and telemedicine, I think, will be a very critical thing. Apart from that, I think more accessible healthcare, specifically in our domain, I'll talk about at-home diagnostics. I think this will be something which is achievable over the next within this decade, and we can actually expand on it and become like you can become like an Uber for diagnostics or health. So so basically testing should become as simple as getting an Uber or an Ola, but which is contrary to what the status quo is. So I think these two areas will be very important. Uh, Telemedicine or digital health along with at-home healthcare and specifically diagnostics because that's like one of the first steps. So yeah, I think that's probably something the most achievable areas where we can make a lot of progress in this decade.
Okay, thank you, Rohan. We are coming to an end of the hour, and I think we have discussed almost everything in threadbare. It was quite like a buffet, a wide variety of things. And I like what you said at the end, Uber of healthcare or Uber of testing. So I think that's a great note to end. I hope we can avail of healthcare facilities as easy as we book a taxi on our Uber app. That sounds great. So thank you so much. Thank you so much for your time and giving your insights to our viewers.
Thank you, Sunil, and thank you everyone who's listening in today.
Okay. Bye. See you.
Bye.